All right, great. Thanks for joining us today for this webinar. This is part of the Pathways to Prevention webinar series. And today's session is entitled Racism, Racist Inequities, and the Child Welfare System, Implications for Prevention. And we're really pleased to be hosting Dr. Alan Dettaff of the University of Houston. So a few housekeeping items before we get started with the presentation. This series is a partnership between the Injury and Violence Prevention Center and the Kemp Center for the Prevention and Treatment of Child Abuse and Neglect. I'm Sarah Brandspiegel. I'm an instructor at the Colorado School of Public Health and Director of Outreach with the Injury Center. Both of our sponsoring organizations are based at the University of Colorado Anschutz Medical Campus, which is in Aurora, Colorado. And as we gather, we acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. And we acknowledge the 48 contemporary tribal nations that are historically tied to the lands that comprise Colorado. The Pathways to Prevention series is designed to connect prevention workers with the latest science on protecting children and ensuring well-being of families. We offer these free monthly webinars for those working in public health organizations, social services, child welfare, and the nonprofit sector. And during these sessions, you'll hear from researchers and people working on various topics in the primary prevention of child abuse and neglect, as well as adverse childhood experiences and related topics. And we always hold these webinars on the 3rd Wednesday of the month at 11 Mountain Time. And we also are recording today's session and we archive the webinars on our website. I'll drop a link in the chat for the recordings in a moment. So if you miss a session, you can always watch the recording at a time that is convenient for you. And our next session is open for registration on March 16th. We will hear from Robert Sagi on healthy outcomes from positive experiences, which is an approach that combines a public health framework to preventing child abuse with a broader understanding of how children grow to become strong, healthy, and resilient adults. And I'll also put a registration link in the chat in a moment for that if you'd like to join us. And last, I want to mention that at the end of the webinar, you'll be directed to a brief feedback survey. And please take a few moments, share your feedback on today's webinar and your ideas for future sessions. All right, so before I introduce our presenter today, I just want to see who's joining us today. So please open up the chat box and add your name and organization where you're joining us from so we can see who's here with us today. Start to come in. Minnesota, Ohio, Indiana, wonderful. Fantastic. All right, so we've got about close to 200 folks on the webinar today. So definitely feel free to use the Q&A function as Dr. Dettaff is presenting. You're welcome to add your questions as we go, and we'll have time at the end for Q&A, and we'll get to as many questions as we can after the session. So now I'd like to introduce our speaker. So Alan Dettaff is the Dean of the Graduate College of Social Work at the University of Houston and the inaugural Maconda Brown O'Connor Endowed Dean's Chair. And prior to joining the University of Houston, Dean Dettaff served on the faculty of the Jane Addams College of Social Work at the University of Illinois at Chicago. He holds a master's in social work and a PhD from the University of Texas at Arlington. And his work focuses on improving outcomes for children and youth in the child welfare system through examining the factors contributing to racial disparities and improving cultural responsiveness. Dr. Dettaff has also conducted groundbreaking research to identify and understand the unique needs of immigrant Latino children and families involved in child welfare. And we're so glad you were able to join us today and talk about this important topic, and I'll turn the floor over to you.
Okay. Thank you, Sarah. I appreciate the invitation to be with you all today, and I appreciate all of you for joining us. As Sarah mentioned, we'll have some time for questions and answers at the end, so I hope that, I know I'm going to go through some of this material probably rather quickly because we have limited time, but I'm happy to engage with you at the end in questions and happy to take questions afterwards as well. I'll have my email information at the end. So to start us off today, I thought I'd just give a little bit of an overview of what we're going to talk about. Today, I'm going to overview what we know about racial disproportionality and disparities in the child welfare system. I'm sure many of you have some familiarity with the topic, but we'll do a brief overview with some of that. We'll look at some of the evidence of the harm that results to children and families from child welfare intervention, as well as the disproportionate harm that results to Black children and families because of that disproportionate representation. And then I'm going to talk about abolition as a solution to ending the racism and harm that results from child welfare intervention. Many of you have likely heard about the abolitionist movement in the child welfare system, but I hope we can really explore that a little bit more and what abolition really means. So to frame the issue of what we're talking about today, racial disproportionality, as I'm sure some of you know, is not a new problem for the child welfare system. It's been observed in the system for at least 60 years, or been documented for at least 60 years, but persists as a problem. But due to a debate that's been occurring in the field, largely among academic circles over the last 10 to 15 years, about the causes of disproportionality, many of the efforts that had been going on in the early to mid 2000s have stalled, and what we've known has been a problem for literally decades remains unresolved today. But that disproportionate involvement causes disproportionate harm, and the failure of the system to address that harm just leads to that harm being perpetuated. So given the inability of the system to address the issue of overrepresentation of Black children and other children of color, given the harm that results from that intervention, I and many others believe it's time to start thinking about new ways to respond to children and families that we'll talk about today. So a brief overview of racial disproportionality. In its most simple sense, disproportionality means a state of being out of proportion. And that could happen in any social service system. In the child welfare system, when we talk about disproportionality, we usually are talking about a group in the child welfare system, typically children in foster care, when that group is either proportionately larger or proportionately smaller than that same group in the general population. When we think about a problem of disproportionality or concern, we tend to focus on the overrepresentation, but disproportionality could also be underrepresentation. And then disproportionality has most significantly impacted Black children, who represent nationally about 25% of children in foster care, but only represent about 15% of children in the general population. Racial disproportionality, it's important to note, also exists among Native American and Latinx children, but to a lesser degree and with much variation by state. If you were to look at state levels of disproportionality, you would see that Black children are overrepresented in nearly every state, I think about 46 out of 50. If we were to look at Latinx and Native American children, there's a lot of variation by state where there's a lot of underrepresentation in certain states, some overrepresentation in others, but the problem has most significantly impacted Black children. Here you can see, we could look at this national chart where you could see here, Black children are the blue bar on the bottom, and you'll see, as I mentioned there, 15% of the population, but about 25% of children in foster care. So that's a disproportionality index of about 1.7. If you were to look at white children or Latinx children, which are the green and purple bars, you'll see that their proportions in the population are greater than their proportions in care, meaning they're underrepresented. The very small light blue at the top represents Native American or Indigenous children. You can see that they're about 1% of the population, but about 2.5% of children in care. So the rate of disproportionality is actually more extreme for Indigenous children. Because the population is so small, most of the research and most of the conversation has been around Black children and families. And again, because it exists in every state as well as at the national level. Here we could look and see specific to Colorado, and you could see here that the population of Black children in Colorado is about 5.7%. The population of children in care is 11.7%. So you could see that Black children are represented in foster care at a rate about double their proportion in the general population. Here you could see that there is also in Colorado some disproportionality of Latinx children, where Latinx children are about 31% of the population, but 39% of children in care. So you see some overrepresentation there for Latinx children in Colorado as well. But if you were to look here at these disproportionality indexes, you'd see that the largest problem in disproportionality, again, is specifically with Black children, where Black children are represented at a rate more than double their proportion of the population, whereas Latinx children is the ratio or the index is 1.25. So there's some overrepresentation, but the most severe problem in Colorado is as it relates to Black children's overrepresentation. So then racial disproportionality is different than racial disparities, but they're very closely related. Racial disparity or racial disproportionality results from racial disparities that occur in different entry points to foster care and exits from the system. So disproportionality is this state of being out of proportion, this overrepresentation among children in foster care. And then racial disproportionality results from disparities that impact entries and exits from the system. And we know from decades of research that Black children are more likely than white children to be reported for maltreatment, to be confirmed or substantiated for maltreatment, to be removed from their homes and placed in foster care. And then Black children also spend more time in foster care and are less likely to exit to reunification. So those disparities that impact Black children in both entries and exits create disproportionality. So why do racial disproportionality and disparities exist? This has been a conversation in child welfare and in academic circles for many years, for decades. And what we know about disproportionality is, if you were to look at all of the evidence from this, there's essentially four factors that create disproportionality. Disproportionate need, what some people refer to as disproportionate need, which largely means poverty and related risks that lead certain populations to be more likely to have contact with the system, racial bias within the system and among mandated reporters, as well as institutional racism in like the policies and practices of the system, child welfare system factors, high rates of turnover, an inexperienced workforce because of that turnover, high caseloads, as well as a lack of resources to address some specific needs of families of color. And then geographic issues, things like concentrated poverty within certain neighborhoods that create risk, as well as surveillance that happens within communities where there's concentrated poverty. What we've seen over the last 10 to 15 years is a large debate in largely the academic field that has really honed in on this issue of disproportionate need. And there are many researchers that push back against the idea of racial bias contributing to disproportionality, and will say that disproportionality results from poverty. That's what we really need to focus on. Efforts to address disproportionality don't need to address things like racial bias, because that's not really a problem in the system. I'm sure many of you have heard that debate. I will tell you, briefly that's just simply not true. Racial bias and racism are large problems within the system, and there's plenty of evidence to document that. But even despite that, I think what's really important to point out about what causes disproportionality is that if you were to look at any of these four factors, examine any of these, each of them result from a common underlying factor, which is structural and institutional racism. Yes, absolutely, Black children are more likely to be living in poverty than white children, and as a result, they're more likely to come in contact with child welfare systems. But the reason Black children are more likely to live in poverty is because of centuries of structural and institutional racism in the United States that make it more likely that they're going to live in poverty. And you can see that represented here on this chart. When we look at all of the kind of external things that happen outside of child welfare systems that lead to the overrepresentation or the greater likelihood of Black children to be involved in the system, I think it's always important to start out looking at this historical lens and acknowledge that the forcible separation of Black children from their families has been a practice that's been happening in the United States for over 400 years, beginning as a practice during the times of human chattel slavery, as a means to maintain the oppression of Black children and families. That practice is now done by the child welfare system, but its legacy is in human chattel slavery. And then what we saw happen in the United States is that after abolition of slavery, policies were created by the government over the decades that followed for the explicit purpose of maintaining the oppression of Black families and maintaining a system of white supremacy, which was now threatened by abolition of slavery. So we saw things like the Black codes, the Jim Crow laws, redlining, things like the way that the GI Bill was implemented. All of these things were done by the government for the purpose of maintaining the oppression of Black people and ensuring that Black families would continue to be disproportionately represented among those living in poverty. So then the laws and policies that followed abolition of slavery led to the wealth gap, education gaps, employment gaps, and all of the factors that contribute to poverty. The policies that resulted or followed abolition of slavery lead to the racism that exists today, which has a direct impact on the health and stress of Black families, and also leads to the geographic conditions that we see, issues of concentrated poverty, which result from things like racial residential segregation, disparities in housing, concentrated poverty, mass incarceration, or I would refer to that more as mass criminalization within certain communities. All of these things create the conditions that make it more likely that Black children and families are going to come to the attention of the system. But then when we look at the system itself, it's important to just briefly acknowledge the racist origins of the child welfare system, which largely began during the times of the orphan trains. I'm sure many of you are familiar with this in Children's Aid Society. The Children's Aid Society is an organization funded by Charles Loring Brace, who developed a system that's been referred to as the orphan train movement that was designed to essentially save children from poverty. Charles Loring Brace was concerned with a population of street children that were living on the streets of New York City, that were engaging in things like petty theft as a means of survival, and developed a system because of the rapidly expanding population in the Midwest at the time, developed a system that these children could be sent to live, these children whose parents were either severely ill or had passed away, which is why they were living on the streets. He developed a system for these children to be sent to live with rural families in the Midwest, where they would be raised as part of those families, but then also contribute to the labor that was necessary to expand westward in the United States. So you'll often hear, and that became essentially what we would now call foster care, a very different model, but we would now call foster care. You'll often hear stories about that will say up to 200,000 children were moved from the streets of New York to live with these rural families by the orphan train movement. That's slightly inaccurate, because what's important to point out is that over 200,000 white children were moved to live with white rural families as a result of the orphan train movement. Black children and other children of color were intentionally excluded from the orphan train, from the Children's Aid Society, as well as other charitable organizations. The settlement house movement that was being done, led by Jane Addams at the time. Black children were intentionally excluded from all of those services. So the child welfare system began essentially as a means to rescue children from poverty, but specifically to rescue white children from poverty and exclude Black children from all of those services. And then when you get into, then if we fast forward a bit to passage of the Social Security Act, aid for families with dependent children. I took a screenshot of this article here, and there's a citation on the bottom there. It's a really good article that talks about how the child welfare system moved from a system that intentionally excluded Black children from their services to a system that over-included Black children in their services. And what we saw is, as the system shifted from one that was focused on poverty relief to a system that focused on the idea of protection, we saw Black children become very rapidly involved in the system. And specifically what happened is, during that time, after passage of aid for families with dependent children, as Black families became more eligible to receive those poverty relief services, we saw racist policies that were implemented to exclude Black families from participation in accessing those services. Those were often in the form of morality clauses that were attached to eligibility for AFDC, or ADC as it was initially known. So those were things like home unsuitability clauses, or sometimes they're referred to as man in the home clauses. All of these subjective things were used to exclude certain families from receiving welfare, or to kick families off of welfare rolls. And in the late 1960s, we saw, particularly in two states, in Louisiana and in Florida, tens of thousands of Black children were kicked off of the state's welfare rolls because of these eligibility clauses or unsuitability clauses. That created enough public outcry to lead to what was known as the Fleming Rule, named after the head of DHHS at the time. And the Fleming Rule banned the practice of using these eligibility clauses or these unsuitability morality clauses to determine eligibility for receiving aid. But it also required that all of the families who were kicked off of the welfare rolls in those states be investigated by the state's child welfare agency. So what you saw happen is tens of thousands of Black families who were kicked off welfare rolls were investigated by white caseworkers and subsequently placed in foster care. So this is what initially in the 1960s led to what we now call racial disproportionality. And then what we've seen over time is this idea of a white middle-class parenting standard used to create child welfare policy, starting with mandatory reporting laws through CAPTA, the Adoption and Safe Families Act, and a discretion that's built into child welfare policy. So child welfare policies begin with an idea of a white normative parenting standard that all other families are judged against. And then you have a huge amount of discretion that's built into child welfare policies, going back to this kind of principal idea of the best interest of the child, which allows a lot of subjectivity into decision-making that continues to create bias within the system that leads to more Black children becoming involved in the system. I'll show you here some, as I mentioned, there is an entire body of research that shows evidence of bias in the system. I'll briefly point out some work that I was involved in Texas in the mid-2000s, when Texas was under a large reform bill at the time to examine disproportionality. And I have these cited on the bottom here. So we were engaged in a process of looking at whether disproportionality exists, the extent to which disproportionality exists, and to try to determine why disproportionality existed. And specifically to determine if disproportionality existed solely because of poverty or due to other factors. So we looked at all of the cases in the state over a 2-year period, and we looked at 2 specific decision points: the substantiation decision, or this decision to either confirm or not confirm maltreatment. And then for cases that were in need of some type of intervention, we looked at what that intervention was. Was that removal or family separation, or was that some type of family preservation services? In Texas, they call that family-based safety services. What was novel about these studies at the time is that we were able to control for a number of factors, but specifically we were able to control for family income, as well as caseworkers' assessment of risk, to really try and see the impact of race on the decisions that were made. And what we found is that when controlling for both poverty and caseworkers' assessment of risk, Black children were 15% more likely than white children to be involved in a substantiated case. And then just among those substantiated cases, again, controlling for poverty and risk, Black children were 20% more likely than white children to be involved in a case that was open for services. And of those cases open for services, Black children were 77% more likely than white children to be removed in lieu of receiving in-home services. And the only factor that explained these differences were the race of the child. That's evidence of bias occurring within the system. We also looked at risk assessment scores to determine how these were being differentially, or if they were being differentially assessed, if families were being differentially assessed. And what we found here is, this is a snapshot of just removal cases. We found, as you can see, that low-income families were assessed as having higher risk than high-income families, which was to be expected. I'll briefly back up. Texas at the time used a risk assessment scale that was a Likert scale that assessed 7 different factors of risk on a scale of 1 to 5, 5 being the extreme risk, 1 being the lowest level of risk. So the highest possible score you could get is 35, and the lowest possible score you could get is 7. So again, it was expected that families, low-income families, would be assessed as higher risk than high-income families. But what we found is that there were differences between how Black families were assessed in their level of risk compared to white families, regardless of income, at both low-income levels and at high-income levels. And what we found is that Black families were consistently assessed as having higher risk or greater risk than white families, or I'm sorry, I said that wrong way. White families were consistently found as having higher risk than Black families. Black families were assessed as having lower risk, yet Black children were 77% more likely to be removed, even though their level of risk was scored as lower than white children. That told us also that there were differences in the decision-making threshold that caseworkers were using to make a decision to warrant a removal. Meaning that when for a white family to be subject to a removal or a family separation, the risk had to be all that much higher than a Black family, whereas Black families were removed or separated at much lower levels of risk. Again, evidence of bias impacting decision-making in the system. So I think this idea of language and how we talk about this issue is important. The terms that we've been given to talk about this are things like racial disproportionality, racial disparities. I think that those terms actually mask what's actually going on in the system. I use the term racist inequities to describe what's happening in the child welfare system because these are inequities that exist because of racism. When we say things like racial disproportionality, racial disparities, it makes it sound like these things just kind of happen to Black children. That's not what's happening. These things are happening to Black children because of racism. And I think it's important that we use language that connotes that. So then let's talk for a minute about this idea of harm and the disproportionate harm that results because of the disproportionality that exists in the system. Starting with family separation. And we know that the act of family separation causes significant trauma to children, regardless of the length of the stay, regardless if the stay or the separation is a short-term separation or a long-term separation, results in significant trauma. And that trauma is associated with things like cognitive delays, increased aggression, poor educational outcomes, as well as adverse physical health outcomes, things like hypertension, difficulty sleeping, obesity, diabetes. And this is consistent across different types of family separation. So we know that this results from family separation that occurs by the child welfare system. And we know that this occurs when due to family separations because of things like parental incarceration, sudden death or divorce. Family separation causes significant harm and trauma to children. In recent years, much of the general public has come to understand the harm that results from family separation. I'm sure many of you have seen, there was a national outcry a couple of years ago when families were being separated under the former presidential administration. That same harm and trauma that results when children are forcibly separated at the US-Mexico southern border, that's the same harm and trauma that people and that children and families experience every day when they're separated by CPS agents. The trauma of family separation is severe and lasts a lifetime. But then even following that, we know that the experience of foster care causes significant harm. Many of you likely know that it's very difficult to isolate the effects of foster care or to separate that from issues that were occurring in the homes of children prior to a foster care experience. But there's been a number of studies that have shown that when we are able to try to isolate the outcomes of foster care, we see that children who experience foster care are more likely than children who don't experience foster care, but have experienced maltreatment to have higher delinquency rates, higher teen birth rates, lower earnings as adults, more likely to have learning disabilities, developmental delays, behavioral problems, more likely to have substance use disorders, psychotic disorders, anxiety disorders, and are significantly more likely to have criminal convictions for violent offenses. So we know that the intervention of foster care itself fundamentally causes harm to children. So there's harm that results from family separation. There's harm that results from foster care as an intervention. It's important to mention here that foster care causes harm to all children. And all children who experience foster care are at risk of experiencing these adverse outcomes. But for Black children in America, they're already at risk of these poor outcomes because of the racism that has existed in society for centuries and the racism that they contend with on a day-to-day basis. So Black children in America are already at risk of poor outcomes over the course of their lives, things like economic hardship, poor health, low educational attainment, criminal legal system involvement. When we then add on, through a government system, the act of forced separation and placement in foster care, it makes it all the more likely that those children are going to experience those outcomes. So what we really see here is a government system that is disproportionately inflicting an intervention on a population of children that they know will result in factors like homelessness, joblessness, poverty, low educational attainment, all of the things that maintain the oppression of Black Americans in the United States are things that the child welfare system is inflicting on Black children and families. So the system itself is an agent of oppression through the intervention that they use, which causes harm to children. So some questions to consider. Can a system that began with a racist intent, again, remembering that the intent of the system was to save white children from poverty while excluding Black children from those services. So can that system evolve into one that achieves equity? Can decades of racist policies be revised in order to become a system that no longer produces racist outcomes? And I think an important question that I'll talk a little bit about more in a minute is racial equity even an appropriate goal for a system that produces harm? My answer to all of these questions is no, and I'll explain that over the next few slides. Which is what led to my involvement in the upEND movement, which is an abolitionist movement to end the child welfare system, and really led me thinking about these questions. My time, from the time I worked in the system in the late 90s, early 2000s. I specialized in child maltreatment investigations for many years. I was responsible for removing children from their families. When I left the agency, I did research for about 10 to 15 years on this issue of racism in the system and what can be done about the issue of racial bias. And I spent most of that 15 years as what you would call a reformist, someone who believed that the system could reform, someone who believed that the system could improve, could do better, could reduce disproportionality, and ultimately came to the realization that that cannot happen. The reason why disproportionality and disparities continue to exist in the child welfare system is because despite decades of reform, the system has never been willing to fundamentally reconsider its intervention of family separation, which regardless of reforms is still the go-to intervention that the system uses. That intervention itself fundamentally causes harm. Until that practice is ended, the child welfare system is going to continue to be complicit in harm and disproportionately harming Black children and families and other families of color. So why upEND? Decades of research, as I said, have documented not only the existence of disproportionality, but also the harmful effects that disproportionality has on Black children and other children of color. And despite the decades of reforms that have gone on to try to address this, disproportionality continues to exist. If you look at rates of disproportionality over time, you'll see that disproportionality has slightly decreased since when it was at its peak in around 2000. But disproportionality still remains very high. In certain states, Black children are overrepresented at a rate more than 3 times their rate in the general population. So disproportionality remains a significant problem for child welfare systems. And the system has just been unable or unwilling to address that problem. As a result, again, this is not a new problem for child welfare systems. The idea of foster care causing harm to children is not a new concept to child welfare systems. I and many others believe it's time to really think differently about how to address disproportionality. And this really, much of abolition, I think you'll see, is a prevention-oriented project. So why upEND? As I mentioned, reforms are just simply no longer efficient. Reforms have not worked, have not addressed the core harm that the system causes. So eliminating racial disproportionality, eliminating disparities, and the harm that those disparities cause will only be achieved when forcible and involuntary separation of children from their parents is just simply no longer viewed as an acceptable intervention by a society that purports to care for children. In a society that purports to care for children, we can't continue to address or try to address harm that happens in families with an intervention that causes further harm, which is what family separation does. So the upEND movement is an emerging collaborative movement that is looking at simultaneously completely ending the use of forcible separation of children from their parents, and at the same time, increasing meaningful supports so that families and communities have everything that they need to thrive, everything that they need to care for their children. Ultimately, we're trying to rethink this idea of state-sanctioned family separation as a response to families in need, and as a response to what are really social problems like food insecurity, poverty, lack of housing, lack of meaningful prevention services. All of these things are things that the government could choose to address if they wanted to, if there was the political will to do that. Right now, when parents are living in poverty, we blame parents for being in poverty, and we punish them by removing their children as a means of distracting ourselves from these larger societal problems that are within the control of the government to address, but they choose not to. We're trying to create a movement that focuses attention on that and leads to some of these changes being made to address the underlying issues that are occurring in many families that could prevent their involvement in child welfare systems. But I do want to be clear, by abolition, we mean the complete elimination of the existing system, which is built on this model of surveillance and separation, and a fundamental reimagining, recreating of the ways in which we as a society care for children, families, and communities. Abolition does not mean creation of a new system. I'm sure many of you have seen there are some movements, there are some organizations that are calling for ending the child welfare system, or I think they use the term transformation, transforming into a child and family well-being system. As long as the government system has the authority to forcibly separate children from their parents, they're going to continue to do that. We believe that practice needs to be ended entirely, and that will only happen through abolition of the system. What's important, though, is that this doesn't mean abandoning the need to care for children. It doesn't mean that at all. It means building new ways of protecting and supporting families in ways that don't involve inflicting further harm, so in ways that don't involve forcible family separation. We acknowledge abolition is absolutely a process. Abolition is not something that we're calling to happen tomorrow. We believe there are ways to slowly move towards an abolitionist goal for the system by beginning to dismantle the racist policies, the racist practices of the system, while simultaneously providing the resources that families need so that all children and families can stay safely in their homes and have everything that they need to thrive. Abolition is also a process of reimagining. It's about co-creating this vision for society and what that would look like with organizers, with parents, with youth, with people who have been impacted by the system. And what we're ultimately looking for is systems of support that are led by communities that intervene when families are in need, and that those communities have the resources that they need to be able to appropriately intervene and provide families with what they need. So we're talking about things like a universal basic income, a child allowance, safe and affordable housing. I'd go further with that, say a housing guarantee, jobs that pay sustainable wages, free and accessible mental health services, food, domestic violence support, substance use services, free and accessible substance use services for everyone who wants and needs those services. All of these things are within our power to create. So if we were to create this then, and again, I know we can't create this tomorrow, but if we can start working towards creating this, this is essentially a prevention model. We have families who have concrete supports. We have residents of communities who intervene. Residents of communities are first responders rather than a state system. Community members provide support when needed. We have all of the supports exist within communities, and communities have the resources that they need. So when harm occurs, communities address that harm and determine what needs to happen and what's in the best interest of children and families. Essentially a community system of care that minimizes and addresses harm in ways that don't cause further harm. I wanted to briefly mention racial equity because it's really timely now. Many of you probably saw that the system just put out an information memorandum, or the Administration for Children and Families just put out an information memorandum last week on February 2nd about their commitment to racial equity. For those of you who've been following disproportionality work and engaged in this work for decades, you've probably seen like mid 2000s, early 2010s, there was a lot of emphasis on addressing disproportionality. There was a lot of funding, a lot of philanthropic support to address disproportionality. That all changed around like 2010, 2011, in large respects because of this debate about what really causes racial disproportionality. A lot of the funding stopped, and there wasn't a lot of conversation about disproportionality occurring in the field. That shifted in summer 2020 when white people in America became aware of racism being a problem within some of our government systems, and particularly within policing. And racial equity has become a focus for many government systems in the years since then. And racial equity is now the goal of the child welfare system. It's widely publicized as a new goal, or the priority for this system. But again, think about everything that we've talked about in this brief time that we've been together today. The goal of racial equity makes sense on the surface. If disproportionality has been a problem for decades, then the solution to disproportionality is proportional representation, right? Which is racial equity. But if the system were to achieve racial equity, you still have a system that forcibly separates hundreds of thousands of children from their parents, many of whom don't need to be separated. Those separations are just distributed equitably by racial group. That's what racial equity means. But because of the fundamental harm that child welfare systems cause, racial equity doesn't really solve anything. Equitable harm is still harm, and proportionately providing harm, or proportionately using an intervention that causes harm, should not be the goal of the system. The harm that the system causes will only end when the system is no longer exists and is no longer able to perpetuate that harm. At the upEND movement, we've put out a kind of big picture policy proposal for what we believe needs to happen to move towards abolition. This policy proposal is available at our website, which is on the bottom there. It's upendmovement.org. And it contains our ideas in these 7 big picture categories. It's not a very prescriptive policy proposal because we believe some of the fine details of this need to be done with engagement of families and communities who've been impacted at the local level. But in a big picture sense, our policy proposal calls for ending involuntary separation of children from their parents, reuniting children who are currently in care with their families, ending surveillance of families, so ending things like mandatory reporting laws, as well as things like non-consensual drug testing of birthing people, and then looking at things like prioritizing care over punishment, looking at how to address harm in ways that don't cause further harm. So this is things like decriminalizing drug use, decriminalizing sex work, things that stigmatize parents for certain things. Transforming societal conditions is where we talk about all of our ideas related to universal basic income, child allowances, things like that. Reimagining care, shifting power to families as first responders, again, going back to this idea that if communities had all of the resources they need, then when harm does occur, communities can be responsible for addressing harm in ways that don't involve contributing further harm to children and families. So I want to close with these couple quotes from Ruth Wilson Gilmore, who is a longtime prison abolitionist. When I and others started conceptualizing the upEND movement, we learned a lot about abolition theory, and came to understand that the idea of abolition and abolition theory, abolition praxis, is something that has been being developed for decades now, and we use that theory as part of our work. And what's, I would say, most commonly misunderstood about abolition is this first quote from Ruth Wilson Gilmore that says that abolition is about presence, not absence. Oftentimes people think that abolition is solely about ending something, which will then leave people continuing to be in need, children continuing to be harmed. Abolition is as much, if not more so, about presence than it is about absence, meaning abolition is about creating all of the things that we need to create in society so that there's literally not a need for a child welfare system. I often say that the movement to abolish the child welfare system is not a move to just simply end the child welfare system or in the practice of foster care. It's about creating a society where the need for foster care is obsolete, where the idea of forcibly separating a child from their parents just simply wouldn't happen because society would view that idea as so abhorrent. And it would never need to happen because families have everything that they need and wouldn't need that type of intervention. Ruth Wilson Gilmore often also says, abolition is a way of seeing. Abolition makes you ask, when you look, what are you seeing and what would you rather see? When I look at the child welfare system now, I look at a system that disproportionately surveils Black and brown bodies. I look at a system that disproportionately separates Black and brown children from their parents as a means of trying to respond to harm, but in a way that causes more harm. What I would rather see is children, families, and communities have everything that they need to eat, to thrive, to live in their communities safely, protected in their homes and communities. That's what abolition is about right now. If you think about what the system does, and I'll close with this and then we'll have some time for questions. As I'm sure many of you know, there's a kind of common perception in the general public that the child welfare system is intervening always in cases of severe harm. But as I'm sure you know, those cases are very infrequent. What we have is a system that is primarily responding to issues of poverty. More than 60% of children in foster care are in foster care because of what the system calls neglect. Only 17% of children nationally are in foster care because of physical or sexual abuse. So we have a system that is essentially removing children from their parents because of issues that are largely poverty related. And then we place those children in the home of strangers and then pay those strangers money to take care of someone else's children. In the state of Texas, we pay foster parents an average of $900 a month to take care of someone else's children. What if we just gave that $900 a month to the family or to the mom who's struggling to meet their children's needs? We're literally paying strangers to take care of other people's children when all those children's parents need is money. That's what I think we could start to addressing. If we could start by looking at just the cases that are largely poverty related and looking at the billions of dollars that are spent to maintain the system of foster care and start redirecting that to families and communities, we could start building a society where the need for foster care is obsolete. I'll close here with some questions, discussions. I thought I had my email on the slide, but I'll put it in the chat. You could also reach out to me on Twitter. A lot of conversations happen about child welfare work and child welfare research there. I'll go ahead and put my email in the chat if we don't get time for your questions right now. And then I'm happy to take some questions.
Thank you so much. Such a powerful talk. I really appreciate you coming and sharing these ideas with us today, and also sort of your personal journey and how you've gotten to this point, and the work of the upEND movement. So we're getting lots of questions. We'll get to as many as we can today, and I really appreciate you kind of being open to folks contacting you afterwards as well. So let's see what's coming in. There's questions about sort of the policy landscape. So a couple pieces. One is the current policy landscape and your thoughts on CAPTA and how it will likely be reauthorized in 2022, as well as questions about, like, are there any parts of the US where policymakers are taking this abolition idea seriously? Are there any models you can point to as sort of glimmers of hope for this work?
Yeah, sure. Well, my thoughts on CAPTA is that CAPTA should be eliminated, that mandatory reporting should be repealed entirely, because we know that mandatory reporting laws are what starts this process of bias, leading to decision-making that disproportionately brings Black children and other children of color into the attention of the system. So mandatory reporting laws need to be ended. There is a movement to replace mandatory reporting laws with what some people call mandatory supporting, meaning that rather than people having a responsibility to refer a family to a child abuse hotline, they would have a responsibility to refer a family to some type of helpful service or provide some type of aid to families, but wouldn't have the responsibility of reporting families to the hotline, but would have a responsibility to referring parents to some type of helpful service that could provide really resources and supports to address the issues that are addressing the concern. I would say the glimmer of hope, much of the activism and work related to this is happening in New York City. That city is ACS, the Administration for Children and Families. If you're interested in the work, one of the abolitionist movements there, the woman who runs this, her name is Joyce McMillan. She has an organization called JMAC for Families. You could Google that, it's jmacforfamilies.org. And you could see all the legislation that she's proposing, which also address mandatory reporting laws. She's also really advocating just starting with something which seems like low-hanging fruit to me, which is just having a requirement that parents receive a notice of their rights, similar to what the police have to do with Miranda warnings, before parents agree to talk to Child Protective Services agents. That was recently proposed and it was defeated because the child welfare system actively opposed it and worked against it. So you have a bill being proposed for parents to know what their rights are before engaging with the system, and the system actively opposing that legislation, which just tells you something about the system and the harm that it knows that it's causing. Like, the system knows that the only way to keep doing what they're doing is by deceiving parents. So they don't want parents to know their rights. But that's where the glimmers of hope are happening in the New York ACS system right now.
Wonderful, thank you. Before we move on from the policy landscape, someone also asked about the Family First legislation and the move towards funding for prevention work. Can you comment on that?
Yeah, I have some concerns about Family First. Primarily, I would say, again, the biggest concern is that Family First is just another example of a large reform package that's intended to bring about really meaningful change, focus on prevention, that I believe at the end of the day will result in nothing. We saw that happen with the waiver experiment. All of those dollars were designed or were allowed to be used for prevention activities. What really happened? Did the harm stop? Did disproportionality end? No. I think anytime prevention services are administered by an agency that has the power to forcibly separate your children, they're never going to be effective. The system often talks about the idea of voluntary services. There is no such thing as a voluntary service by an agency that has the power to take your child away from you. All of those services are services that involve some aspect of coercion. And what we usually see is that when prevention is being applied by this agency, those prevention services are applied in ways that just increase surveillance. And what often happens is that this idea of compliance is used as a measure of whether parents are worthy to keep their children or not. So the extent to which families go to these services and the extent to which they're successful going to these services is used as a measure to judge whether they're worthy of keeping their children or not. And there's usually no empathy or understanding of the challenges and difficulties that parents face in going to these services. When I was in the system and we were referring parents to what we called voluntary services, I remember hearing caseworkers set up these visits for families where they would have to go to counseling and substance use treatment and anger management, and they're all in the day during work hours, and they're all in places across town that they have trouble getting to. And when parents would express their concerns or literally say, if I go to this service, I'm going to get fired from my job, I would hear caseworkers say, well, this is about your children. This should be your priority. You need to figure it out. That's how the system implements prevention right now. So I don't think that will be successful.
Thank you. A few kind of related questions you mentioned that cases of severe abuse are rare, but we have a few questions about who or what systems should become involved when children are seriously injured, perhaps showing up in an emergency department if CPS is abolished. And someone else asked, how do we safely return an under 5-year-old child who's currently in foster care to a parent who is homeless, has significant mental health, substance use disorder, and refuses to engage in treatment? And I know this is a question you get often, so curious to hear your answer.
Yeah, it's absolutely a question that I get often, and I understand where the question comes from, which I think why it's important to say again that the idea of abolition isn't something that could happen immediately tomorrow. It's a long progress moving towards abolition. I think what's important to point out is that when we focus on these severe cases, or that's like the gut reaction that we have about these really severe cases, which are really a small number of cases, that prevents us from doing this imagining work, and it prevents us from doing the work that we can start doing today to literally stop removing 70, 80, 90% of children who are currently being separated that don't fall into this severe category. So that's important to point out. I think that it's also important to acknowledge the child welfare system, the existing system, doesn't keep children safe. Children are often abused in foster care by their foster parents, by staff of residential treatment facilities. So the child welfare system, as it stands right now, is not keeping children safe. But I think that like the bigger thing to think about is this question about what if there's no child welfare system, what will happen to the children who are being severely harmed? In a lot of ways, I think that's the wrong question. I think the question that we need to be asking ourselves is, why do we live in a society where some children are severely harmed by their parents? And what could we do about that? That's what abolition is about. That abolition is about looking at the reasons why harm exists and trying to address that. What I know is that so I don't have the 10-point PowerPoint slide to show you about how the child welfare system, or about how we should handle cases where there is severe harm. I know that we should be doing that in ways that don't cause further harm to those children and families. And I think if we start to think about what we can do about that, while we stop removing the 90 to 95% of children that aren't severely harmed, we can identify those solutions.
Thank you. Raising a lot of important questions. I'm seeing so many good questions come in. George asks about academics' role. What changes are needed in academia to support the move to anti-racist policies and community support systems? And we had another question about folks that are interested in research. How do you engage with your work or with research opportunities in their area? So could you just comment on the research and academic perspective on this and the sector's role?
Yeah, I think the academic piece is a really important one that I think about a lot as dean of a school of social work. And for me, so I think a lot about social work's role in this and social work's complicity in harm. And I think whether it's social work or other academic disciplines that are involved with this system, I think we need to do a better job of educating students, people who are going to be going into this system, about the harm that the system causes. Speaking specifically of social work, I think that social work needs to really examine itself and what we say about our professed values. As we have it stands right now, social work has a code of ethics and a value system that says that social workers must take action against oppression, racism, discrimination, and inequity, while we simultaneously work in a system that is responsible for oppression, racism, discrimination, and inequity. Those two things can't exist at the same time. So I think the profession of social work needs to figure out, what do they really stand behind? I think social work needs to completely disavow ourselves of the system as part of an abolitionist movement and work to abolish the system from the outside. On the research piece, I would say we're in the upEND movement right now working on developing a process to develop a research agenda for the child welfare field using an abolitionist lens. We hope to be launching that project by summer, so there may be opportunities for many of you to be involved. We're not developing the research agenda, we're developing a plan for how to engage with people to help us develop the agenda, but using an abolitionist-oriented lens toward creating a research agenda for the field. So that's something that I hope to be able to share with all of you. And again, if you follow our website, upEND Movement, follow us on socials, we'll be saying more about that and how you can be involved in it.
Wonderful, thank you. I'm seeing lots of folks in the comments just saying thank you. This is so impactful and it's so important. Do you want to kind of close this out with any final thoughts? I know we didn't get to all the questions that came in, but kind of last words, or if people could do one thing in their communities, in support of this kind of different framing of what our systems could look like, what would you suggest people do?
Yeah, I appreciate that. I think that the main thing to do is try to reframe the narrative about the system. The child welfare system itself has done a very good job of perpetuating the myth that this is a helpful, needed, benevolent system. And that's not at all what it is. That's not at all the outcomes that children and families experience. In order for there to be political will to create any of these changes, people need to understand that, though. I often think of this movement as very similar to the defund the police movement, in the sense that this is literally about money being redirected from one system to helping families and communities. The difference is, you all could literally probably turn on your TVs tonight and see how harmful the police are to Black Americans. The child welfare system doesn't have that, a comparable thing like that. The myth of the system being helpful is prevalent. So the more that you could do to help try to reframe that narrative, the more we could do to build the political will to lead to some of the policy changes that are necessary to bring about these changes.
Wonderful. Well, thank you so much for this conversation. Thanks to everyone listening for sharing your questions, your ideas, your thoughts on this really important topic. And I'm so glad that we could take this hour. For everyone listening, if you missed it or you want to review this, we will send by email the access to the recording of this session. And thanks again, Dr. Dettaff, for being here today.
Thank you all. Happy to follow up with anyone afterwards.
Okay, take care.
Bye-bye.